Right now, we have Dr. Kevin Kavanagh, a retired physician and founder of Health Watch USA. Dr. K, good morning, sir.
Good morning, Jack.
How you doing this morning?
Doing pretty good, pretty good.
Well, we were giving the Kentucky statistics on COVID from yesterday that the governor shared, and our death rates, I guess not only in Kentucky, but across the country, and cases continue to fall.
That's correct, and that's good news. And also, our vaccinations are expanding. He announced that we should have approximately 29% more vaccines available to put into arms, and that is good news.
Well, that's good. Now, this morning I grabbed this because I thought this would be of interest. Let's see, this is from the CDC. You know, they're saying 2 masks are better than 1, but there are 2 mask combinations that you shouldn't wear. Don't wear a second mask over an N95 or a KN95. The N95s are designed to fit tight and make a seal, and wearing a second mask on top could make it fit worse. Plus, it could be hard to breathe. Don't use 2 disposable masks on top of each other. We're talking about the blue surgical ones. They're not designed to fit tight and make a seal, but wearing a second one can mess with and prevent you from breathing through the fabric. So more air comes through that. And then finally, as they say, you can wear 2 cloth masks or a disposable mask and a cloth mask because they tend to fit better that way. And the CDC recommends putting the disposable one on first and then the cloth mask over the top of it. So now you know.
That's correct. The take-home message is if you have an N95 or KN95, you're good to go. And the second mask is mainly designed to help the fit of the first mask. And so that's kind of the overall concept there.
Okay. What do we know in terms of CDC recommendations for getting kids back in the classroom?
Well, I think they're fairly confusing. Personally, I think they're kind of lax. They leave a lot of leeway to the decisions of the schools and the community, and not so much to how the virus acts. As you know, Jack, from the get go, well, mid last year, we were talking about getting ready to open schools, of getting PPE, getting class sizes down, doing podding, getting testing geared up, fixing of the ventilation systems in the schools so that there's better air exchanges, there's better air sanitization, and all of this needs to get done. And right now, everybody's looking at these recommendations and guidance and saying, oh, well, that can't possibly be done. Well, really, we had a year to do it. And most of these things should have been done anyways. Even if COVID wasn't here, we need healthier buildings and smaller class sizes for our children in school. They should be our imperative in this society.
And I know you've also been concerned about the air filtration systems in schools.
Well, yes, and that's very important. And I don't think that was stressed enough in the CDC guidance. A lot of people are still following the narrative that this virus mainly spreads by droplets. In other words, large droplets that spread within 6 feet. But there's a very good report from the National Academy of Science, which details how this virus also spreads by aerosols. And they define aerosols as less than 100 microns. And aerosols can float in the air. They will not necessarily die right away. They have a half-life of about 1.1 hours. And we need to watch out for. And you do that with a proper fitted mask and fixing the ventilation in schools. This means your central ventilation system. Some schools have even installed ceiling type UV filters. We've had a speaker from Harvard that thought the latter was even more efficient at getting the virus out of the air. So I think we need to look at both of those. And of course, you have to drive the rates down in the community so there's not that much virus to take care of in the first place. So driving down community rates is key. Even if it's safer in schools, let's say it's twice as safe. But if it's 10 times unsafe in the community, that equates to not being safe in schools too. So let's drive down community rates. And luckily in Kentucky, that's the direction we're going in. So we really do need to keep up with following public health advice.
By the way, Dr. Anthony Fauci's been awarded a huge prize for his work on infectious diseases, including coronavirus. He is the recipient of a $1 million prize, part of the 2021 Dan David Prize from Tel Aviv University in Israel. How about that?
Yes, I think he's done a good job. And I know that there's been a lot of criticism of Dr. Fauci, but when you look at his guidance, it changed pretty much with the science as it changed with the virus. And he's been on target with trying to get things done and accomplished. So, of all the scientists we had last year, I think Dr. Fauci, he was really on the ball. And so I think he deserves a lot of credit, especially for someone who should be late in his retirement and instead out there doing public service.
Dr. Kevin Kavanagh, thank you. We'll talk to you on Friday.
Thank you, Jack.